Well, thank you for coming back and joining us again. We are about to start our fourth episode of Optimal Healthcare's Let's Talk About Health. And Dr. Jacob Minang has agreed to complete answering even more questions on our COVID-19 pandemic. And this session will be more about how it affects us individually and our families. Thank you, Dr. Minang. I really look forward to this session.
Thank you, Karla. It's a pleasure to be back.
So last time we spoke about some of the ingredients that were used in the testing. And today I have received questions on what is the latest on COVID, the vaccines, and how does it affect pregnant women? That's been a very strong concern for women who are expecting. If they get a vaccine, how will it affect them? Or if they get COVID, what are the potentials for how that could affect them?
That's a very good question. First I have to point out that in vaccine research has two phases. The first one, more crucial and most important, is the safety phase. The second phase is efficacy phase. And what is the difference? The safety phase is focusing on making sure that the vaccine, just like any other new compound out there, is safe. A lot of the testing for safety is done in vitro, in test tubes, making sure that it doesn't randomly kill living cells. And then the next phase is testing in small mammals like rodents, then the test in monkeys, before testing in healthy humans. And there's a lot of work that's done around that point before you even start finding out if the vaccines do what we expect them to do, which is the next phase, which is efficacy. So when they're talking about clinical trials, phase 1 and 2, the focus usually is just about safety and then a little bit about immunogenicity. When you've passed that phase and you get FDA approved to move to the next phase, that's when you do phase 3 and phase 4 clinical trials. At that point now you're looking for efficacy because you don't worry about it being safe. The question is, does it even do what you want it to do? Does it elicit an immune response?
Okay.
And if it elicits an immune response, which is called immunogenicity, is that immune response protective? Because it may be safe, it might elicit an immune response, but it's a useless response. There's no difference between the group that took the placebo and the group that took the vaccine. Or there's a difference, but it's not significant, which means the benefits are not that good. That's why sometimes we talk about you expect an efficacy of a certain threshold. It could be 50%, 60%, but the higher the better, because the quicker you get to herd immunity. So that's the basic difference between efficacy and safety. So now when you come now to different populations, most of the side effects of a vaccine has to do with the immune response. It's actually our bodies doing harm. Mm-hmm. And so the underlying conditions between different human beings are very important to look at that point. Because in terms of the side effects, they are standard for any foreign body that you give. But in terms of just eliciting an immune response, that's all the vaccines are going to do. That's the only thing they will do. It's not because messenger RNA, for example, in the case of messenger RNA is dangerous because our bodies already have that. So that in and of itself is not going to elicit a response to you. But it's what is coding when you eventually translate it into a protein, which is a foreign protein, and your body now generates an immune response. Is your body capable of being able to shut down the response once it has done its job? Or does it go on and on and on? And then you end up with more or less what is called immunodysregulation as opposed to immunoregulation.
Well, if a pregnant woman gets this vaccine, will her child then be considered vaccinated as well? Does it go through the bloodstream that way?
Okay, so first off, I have to point out pregnant women are not allowed to take the vaccine, are not encouraged to take the vaccine.
Okay.
Okay. And the reason being that in science, we go only with data. We're not speculating. We speculate to do studies, but we don't speculate to give advice. So when you're testing a vaccine, you usually test it among healthy adults between the ages of 18 and 55, maybe down to 16 lowest, but not below that. You don't include pregnant people. You don't include people that have underlying conditions, because even though you have proven that it's safe first before wanting to test it, you know that it always goes beyond just safety. Sometimes, even though the substance is safe, it might elicit a response that's deleterious in people that have underlying conditions. So it wasn't tested among pregnant people. So we don't know how to react to it. So you put them in the back of the line, hoping that if you vaccinated enough people, they might benefit from herd immunity. And secondly, pregnancy is considered as you having a foreign body in you. So people that are pregnant already have a suppressed immune system. And that's the only way by which they're able to keep the baby. So for you, you should only get the vaccine when you know that the benefits outweigh the risk of any significant side effects, because you're worried about other conditions that if you were infected with the virus, it'd be worse off than if you got the vaccine. Then you take that risk. But there's no need for a pregnant person to be rushing to take it. For the same reason, the Pfizer vaccine is not allowed for children under 16, because it wasn't tested in that population. The Moderna vaccine is not allowed for people under 18. It wasn't tested in that population.
So it's not that they know it will cause harm, it's that
there's no information.
There's no information.
Right.
Wow.
And so they know that they're going to gather that information accidentally, because people are going to make individual decisions to take it. Then over time, they'll get enough data from those individuals across the world that had different underlying conditions, but decided that they were going to risk taking it because they know that it's going to be worse if they get infected as opposed to take the vaccine. From that population, now you're able to get the data that you can now scientifically advise people for or against, depending on what group they belong to.
Wow. Okay. So that was a lot of information. I think we're going to do one more session, Dr. Minang, because we still have some more questions, and the information you're giving is really helpful. So thank you for joining us again today, and I look forward to our next session.
Thank you, Karla.